From MTN News, this is Montana This Morning.
Our voice was just now getting out there.
Pages not found. How frustration is rising in the Crow Reservation as history is deleted among sweeping DEI rollbacks.
Per shift, a lot of times we only have a minimum of 9 patrol officers.
Officer shortage. How Billings police are feeling the impact of a nationwide trend, and they're not alone. How a shortage of doctors is leaving some Montana counties without providers at all. Now hospitals are tackling the issue. Hey everybody, good morning and welcome to Montana This Morning on this Wednesday, March 26th. I'm Augusta McDonnell here with Miller Robson.
Good morning everyone. No, her shoulders are not on fire.
They're not.
That's Kilauea.
That is a volcano erupting on the Big Island, Kilauea.
Yeah,
very cool.
It's been active on and off. It's kind of quiet right now, but boy, it was spewing
right
earlier.
away. There we go.
Yeah, there you go. It's a good shot there.
There we go.
All right.
It's been kind of popping off, and this is a live stream from the U.S. Geological Survey.
There you go.
So you can check it out.
It's a great shot there.
Looks warm. It's going to be warm here, too.
It is going to be warm here. In fact, that might be a live view of Broadwater when we wake up. No, I'm just kidding. It's not going to get that hot, but it is going to be warmer. In fact, today we're going to be about 20 degrees above the norm. Our average high for today would be about 52. Now, yesterday, we didn't quite get into the 60s. That cloud cover I'd mentioned may keep those temperatures down just a bit, and we hit 59, so still a good 7 degrees above the norm. Look at that low, a good 15 degrees above average. Top gust yesterday of 27 miles an hour. Still going to be somewhat breezy today. The western foothills, areas like Livingston, Big Timber, tomorrow, you'll see those gusts over 40 miles an hour, so the winds will start to kick back in. Was dry yesterday. We're still ahead for the month just a bit. For the year, we're in pretty good shape. The snow totals for the month were 2.5 inches in the hole, and if you missed just a few minutes ago, the models are starting to ramp up just a bit, thinking we may have a decent amount of a couple of inches of snow still to go here in Billings, especially when we wake up on Sunday morning, and we'll explore that as we go along. For the season, though, we're still pacing ahead. Temperature-wise right now, milder than normal. We're at 41, feels like 33. Winds out the southwest at about 14 miles an hour. Temperatures across the area, mainly in the 30s and 40s as we wake up. So we're going to see some 70s today, a lot of 70s tomorrow, and some areas still have a chance at records tomorrow. We'll tell you who coming up in just a bit.
All right, Miller, thanks for tracking all of those details. On our top story this morning, the Trump administration is executing a sweeping rollback of diversity, equity, and inclusion content across military and government platforms. It means tens of thousands of pages of stories on Native American heroes, including Chief Joseph Medicine Crow, are gone. As our Haley Monaco explains, anger now fills the Crow Reservation, where history is a key part of life.
Important Native American figures in U.S. military history have been erased from government websites. People here on the Crow Reservation say it's disheartening.
We've endured so much already.
Donetta Jane Halfhold's work revolves around preserving the history of the Crow tribe.
Even I'm still learning every day.
With so much time put into the work here at the Little Bighorn College archives, it's frustrating to Halfholds to see other history taken away.
And I don't know why they did that, because there's hardly any to begin with.
Here is an example. If you search the U.S. Army website for Native American articles, you'll notice there aren't many left.
I think it's a mistake. It's part of history, and Native Americans have contributed a lot to American history.
Articles about Chief Joseph Medicine Crow erased.
Joe was a kind of a model, and he was highly accomplished in both the Native and the white worlds. I was pretty disgusted by it, them taking that down. And here the page tells of his accomplishments, especially military accomplishments.
The Little Bighorn College library director dedicates his life to Indian education.
Are you just wiping the original owners, inhabitants of this country off the face of the map?
I think it's kind of whitewashing, literally, those things in history that are important and people should know about them.
When storytelling is such an integral part of Native culture,
Oral history is how we learned. It wasn't from a book.
And then these are gauntlets.
taking the history away hurts, but Halfholds isn't giving up hope.
They tried to kill all of us, and yet we're still here. So, yeah, we're here to stay. We're not going anywhere.
In Crow Agency, Haley Monaco, MTN News.
Haley, thanks so much. And Riverstone Health here in Billings is sounding the alarm after Yellowstone County has seen 6 overdoses over the last 3 days alone. The patient in one of those cases has died. The spike was identified through an overdose identification system, and while not confirmed, the substance used is suspected to be opioids. Riverstone Health is working together with the Billings Police Department and the Department of Health and Human Services to monitor those overdoses in the county and analyze trends. Naloxone, or Narcan, which was delivered in 5 of the recent cases, is a drug that can reverse an overdose. Riverstone says that it can be purchased over the counter at most pharmacies and can be administered by anyone. The health center also wants residents to know that Montana's Good Samaritan laws protect individuals from providing medical assistance at the scene of an emergency, including drug overdoses. Taking a bite out of crime is becoming more challenging for the Billings Police Department, and they say it's all due to a staffing shortage, with police saying the force is down 19 officers. As our Charlie Kleps explains, it's all part of a national trend that, while taking a toll, is one the Billings Department is working to combat.
Billings Police's annual crime report hasn't been released and won't be for a couple more weeks, but the department expects violent crime to be down. Good news at a time when their department and many other agencies across the country are facing staffing shortages.
Just like any other job, there's good days and bad days.
It's certainly not an easy job. Chasing and fighting crime, a calling few answer.
I wanted to help, serve and protect my community.
But it's the exact right lifestyle for 22-year-old police officer Owen Longabaugh, who actually got his start 2 years ago at age 20.
I think this is kind of like a jack of all trades kind of position.
Longabaugh says the job keeps him on his toes, but admits sometimes it can be overwhelming.
It kind of feels sink or swim at some times, there's a bad day, it's a really bad day.
Long days, certainly not helped by a shortage of police officers in Billings.
We are down a few. However, we swear in 4 new ones here in just a couple weeks.
Lieutenant Samantha Puckett says the department is currently 19 officers short of a full staff, an impact felt as the city continues to grow.
Sometimes we may have to call somebody in to help cover, but they're usually willing to, still cover the street and doing all that extra duty.
Even still, Puckett says there's been big progress made by the department.
From the last I heard, we're still trending down in violent crime. We did get a pretty good handle on the gang problem.
Puckett added that it's accomplished with help from the city. City Council approved 8 more patrol jobs, which they are actively trying to fill.
From when we start hiring them to when they're done with all of their training, it's almost a year.
Community support that's rare across the country, with many departments struggling. Washington, D.C. is at an all-time 50-year low. Baltimore is down 600 officers. And in New York, the headcount is continuing to decline, now 11% down since 2019.
But part of the problem, I think, is just not a lot of people my age seem to want to join. The new hires that we actually get are transfers.
A situation Longabaugh hopes changes, knowing how fulfilling his nearly 2 years on the force have been.
It definitely, benefits me. It benefits the community.
In Billings, Charlie Kleps, MTN News.
Charlie, thanks so much. And the United States is also facing a doctor shortage. In fact, the National Center for Health Workforce Analysis says in the next few years, the country could be short 187,000 physicians. But the question remains, how will this shortage play out in Billings, and what is the level of concern? Our Matt Carmack has those answers.
It's a national issue that's been going on for some time.
I definitely see a lot of demographic trends that are heading that way.
A shortage of family physicians.
I think it is concerning.
Here in Montana, those issues are evident.
There are 9 counties in Montana that don't have a provider at all.
There's a couple reasons we're seeing this trend here in Montana. First, our workforce mostly tends to be made up of older individuals who are likely to retire soon compared to younger generations. And second, it's extremely hard to get medical residents here in the first place.
For instance, 20% of physicians nationwide are 65 and older. Medical physicians here in Montana say preventing this shortage starts with education.
Rural states that don't have large concentrations of populations, big cities, all have challenges in establishing residency programs.
Dr. John Moore with Rocky Vista University says medical schools can only do so much to get their students into local residencies, but Rocky Vista wants to motivate Montanans to come back home afterwards.
We do know that students that are from a particular area that go to training, especially if they can train within that area, have a much higher rate of staying in that area.
Dr. Moore says residencies are complicated, but one local organization trying to dismantle the system is the Montana Family Medicine Residency with Riverstone Health.
We're here to address the primary care workforce and taking care of the bread and butter outpatient issues that most of us go see our providers for.
Dr. James Denisar Green, the associate director of the program, says there are strategies residency programs can do to prevent that shortage.
Younger generations are looking for a better work-life balance in terms of what it looks like to be a doctor.
And that work-life balance may be a part of the problem. For instance, in a recent study, 47% of physicians reported feeling burnt out. But tackling the shortage is going to take some time. Until then, local organizations like Rocky Vista University and Riverstone Health are appealing to younger audiences here locally.
We are really trying to train Montana's next generation of physicians.
We need to continue to grow with the expectations of we want people to be in this their entire life and to give some flexibility in terms of people's training where we can and not be quite so rigid.
In Billings, Matt Carmack, MTU News.
Mac, thanks so much. And finding a table at a restaurant or bar isn't always easy. And for those with disabilities, it can sometimes be impossible. That's something that Mitch Bone has been trying to call attention to in Billings. You've seen him in several stories we've done in the past here on Montana This Morning. Mitch uses a wheelchair and heads up a group called Access Billings. They've been working to make sure that all restaurants and bars are ADA compliant as required. Last night, they held a walkout at Old Chicago in Billings, a place Bone says he's been asking to make changes for over a year.
A protest per se, so we're going to walk in, we're going to say, hey, I'd love to sit in your bar. When they don't let me sit in the bar because they don't have lower seating, we will say, great, thank you, we don't want to spend money here, and we'll leave. This is not badgering. I don't want it to come across as something negative. It's just really awareness for businesses.
5% of tables in restaurants and bars must be ADA accessible in order to be compliant, but there's no one locally to keep them in check. Bone's hope is that more of these businesses will take it upon themselves to be compliant. Concerns continue this week for Billings Clinic patients as the hospital has yet to reach an agreement with Blue Cross Blue Shield of Montana. However, there is some good news in this situation. The two have agreed to a 15-day extension, and the sides on both sides say they hope to reach a new agreement without disruption to patients. If a deal cannot be reached by April 15th, it would affect around 40,000 households across Montana. The current deal was set to expire on March 31st.